concept of narcissism has a long history going back to the early Greeks. Clinical writers began have an interest in narcissism as a clinical entity in the mid 1800s, and in the early 1900s, writers started talking about narcissism at the threshold of a disorder. And it wasn't, though, until DSM-3 in 1980 that narcissism was included as an official disorder in the American Psychiatric Association diagnostic manual. Typically, the conceptualization that was developed at that point was based on ideas that came from Otto Kernberg and Ted Milan, as well as Heinz Kohut, but focused mainly on the overt, grandiose aspects of the disorder, people's concern with power and wealth and beauty and ideal love, essentially having a pathologically grandiose sense of oneself. Although clinical writers had also talked about the other side of narcissism, this more vulnerable side. And a number of clinical writers had also talked about the fact that the grandiosity that you see in narcissistic individuals serves a defensive function against the vulnerability and the feelings of smallness. But the DSM at that time didn't include those aspects of it. And over a number of iterations of the Diagnostic and Statistical Manual, the DSM, we now have a definition that is actually quite similar to the initial definitions that focus in on the grandiose pathological sense of self, which seems to be the defining characteristic. It seems as if future editions based on the research that's occurring will incorporate the more vulnerable side of narcissism, seeing these two aspects, the vulnerable and the grandiose aspects of narcissism, as two sides to the same coin. Typically, there are these oscillations between vulnerable and grandiose states. Kernberg wrote about this most centrally. However, in the 1990s and the early 2000s, there was a lot of research on subtyping narcissistic personality disorder, where through factor analytic studies they identified a grandiose subtype and a vulnerable subtype, and that led people to actually think of them as two different types. However, in reality, there are some people who might be predominantly grandiose or predominantly or overt in their narcissism, and some people who are predominantly vulnerable or covert in their narcissism. But typically, patients vacillate between the two. That the grandiose narcissist, when they face failure, they become deflated and well aware of their deficiencies, and in those moments they can actually be quite distressed and suicidal. And vulnerable narcissists, even in their presentation as being the most disturbed, or the most upset, or the most aggressed upon, have a flavor of the grandiosity in terms of the most or the worst in terms of in terms of their experiences. Narcissism is probably, after antisocial personality disorder, the most difficult personality disorder to treat. And ironically, it's more difficult to treat than borderline personality disorder. And I say ironically in part because a lot of narcissistic personality disorder patients are actually functioning in many ways much better than patients with borderline personality disorder. But there's such a strong defense against any feelings of vulnerability or weakness that it makes it very difficult for therapists to get through that and to actually be able to talk with patients about the kinds of difficulties that they might be having.